Hello friends, this is Dr. Ritu Khanna. I am BHMS MD and I am here to share some information about the coronavirus. As we all know, this COVID-19, that is the new novel virus which has spread across the country in form of pandemic, is really a cause of concern for each and every human being. So first of all, I would like to tell you something about the virus itself. So virus, it is a single-stranded RNA virus which is encapsulated in a bilipid layer, and this had caused some protein spikes all over the surface of the virus. So hence the name comes the corona. Now this is infectivity of this virus is great. It is spreading like anything all over the world. So when we talk about the epidemiology of any disease, then first of all we talk of the agent, then we talk of the host factors and the environmental factors. So already we have talked about the coronavirus, and this virus is spreading from human to human through direct contact or through fomites, like if an infected person is touching certain surface, or another person is standing in the near vicinity of that person who is infected, and the person gets to sneeze or cough, then through the droplets this virus spreads in the atmosphere, and the person standing in the near vicinity will inhale the virus with the droplets inside, and it is going to affect the respiratory system. So in this way this is spreading in an enormous way. So what is required for prevention, management and treatment? So we can discuss a little bit here. First of all, I would like to tell you who all are, as a person, should be taken care of. Like first of all the immunocompromised people. Now who all are the immunocompromised people? Like the old age people, they are immunocompromised. That means their immunity is really low. And then those people who are suffering certain kind of chronic disease, like thyroid disorders can be there can be diabetes, or there can be any chronic infection, COPD. So all these persons, or those are chronic smokers are there. So all these people are more vulnerable to this disease. So what is required is to protect these people first of all. So what all we can do? We can do the first thing in prevention comes the quarantine. So quarantine is a term which we all are familiar these days. That is the isolation of a person, especially the infected person, social isolation for 14 days. And if a person is found infected, then all the contact tracing is done. Travel history is taken from to all places he has been there, and then those person, including those person, the isolation is done, quarantine is done. Otherwise also socially we all have to keep a quarantine. That means we all have to stay at our home. We don't have to go out, so that there is no chances of contact first of all. So quarantine is very, very important. Secondly comes the hygiene and cleanliness. Hand washing particularly is very important, we are talking about. And hand washing with soap and water. Now sanitizers have been in a big limelight. Now I would say sanitizers do have a role, but that doesn't mean if you don't have a sanitizer, like in the rural areas or the poor people, those who are not having sanitizer, that doesn't mean they cannot take the hygiene to that level. It is a simple soap and water which is required to get rid of this virus. Washing for 20 minutes. There's a technique for washing hands I would like to demonstrate here. There are certain steps. We wet our hands, take little soap, and then it is front to front washing first of all, then back to back, then crisscross the fingers, so all the webs of the fingers get cleaned. So it is crisscross. Okay, then there is a thumb and the finger, index finger covering like this, then particularly thumb rotation like this, then fingernails and the palm, right? And after that wrist, and then we can wash it in the ample of water. So this is a 20-second step which this much of time is required to get rid of the coronavirus. So properly, please, everyone should wash your hands. And then comes the health workers who are taking care of these corona patients. They should use the proper protective personal equipments, like use of mask, the body suits and the gloves, so that the health personnel don't get infected, or even the normal person who is going out due to certain reasons, that person should cover the mouth through by a mask, and then only should step out. So these were certain things which are required for the management purpose. Then comes the treatment. Now, being a homeopath, otherwise also I would like to say one thing, that there is no clinically proven antiviral drug for this virus, and no vaccine has come up till now. It is in the formation, but up till now there is no vaccine and no specific antiviral treatment for this virus. But in homeopathy, I would like to advocate, there are ample of remedies for the on the symptomatic background, which can be given for the relief of patient symptoms relief. And then our CCH has also declared few remedies like arsenic, which can be given on prophylaxis basis. It has come out after the extensive research that has been done by CCH. So I would like to quote in the end that please be at home. Whenever there is need, then only you come out. Wash your hands properly. Whatever product you are getting through the market, please wash that product also if it is washable, like fruits, vegetables, even the packets of milk, which can be washed under the water with soap and water properly. And take care. And I would like to request government also to please bring about the homeopathic doctors in this treatment scheme of coronavirus, so that we can also, being a homeopath, provide medication to these coronavirus patients. And I really hope and pray that in near future this virus goes away, causing least number of casualties in our country. Let's hope for the best. Thank you.